Hello, guys and gals, and welcome to the podcast.
Today we express our political thoughts with you at home.
And today, that political thought is universal health care.
As always, we are stating our opinions in a civil discussion with little to no preparation, just our current knowledge and feelings.
So, today, to start off, I'm going to give a brief explanation of what our topic is about. So, universal health care is the idea that all Americans should have access to affordable, quality health care, regardless of their income or financial resources. Universal healthcare systems actually already exist in countries like Sweden, Hong Kong, um, and Kuwait, where the local and federal government pay for most costs associated with healthcare coverage. So, my stance on this is that all people deserve the right to be healthy. Uh, well, like, let's just say that, I don't know, the generic human, Jack, uh, Jack Johnson, he's a person who life deserves to be, you know, just as good as everyone else's. So he deserves to have the right to free healthcare, even if he grew up in poverty, where it was really hard for them to afford, doctor visits or medication that him or his family may have needed. Bradley, what do you think?
I agree that it should be free for um certain situations, but I feel if it's just like a doctor visit, like I have a cough, like because if taxes should go to affordable healthcare. But if we did not pay for healthcare, we would not be able to afford all of the necessities and medicine and surgical equipment and all of that. You know what I mean?
So you mean that we can't just make it completely free? There has to be a way that it makes money?
Yes.
That's where taxes come in, which I know we'll get to later when we know more about it. But like, if we increase taxes on the rich, which we talked about in our last episode, then it could be affordable. Just little less tax cuts for the rich and a little more taxes for the rich that a lot of rich people support. Then universal health care could be easily afforded and we would still have the money and the resources for all the necessary things. And like you were saying, I don't think you should, you don't necessarily have to go to the doctor if you just have a cough. But if you're, seriously sick and you need to go to the doctor, then you should be able to go to the doctor for free. And uh, another point, an ambulance, a lot of people who are even in critical health, serious danger, they won't get an ambulance because they can't afford it because it costs too much money to get a safe drive to the hospital.
Yeah, I do agree with that. I feel ambulance rides and life or death situations should be like a and it should be a right to be healthy and safe and not have to spend money to just even live in some situations. But I do have a different aspect on the taxes going to healthcare. It should go to healthcare, but you have to think there are many other things in America that we spend our taxes on.
Yeah, it doesn't. I mean, you don't have to spend all of the rich people tax, all of that 2-3% on healthcare. It can be spread out. If all the people who own $50 million or $60 million spend at least 2,000, then we would there's plenty of millionaires in America. We could divvy that out to public housing, universal health care, any of the anything that the U.S. may need money for. Just like taxes in general, we don't give our entire income to one specific cause. We give a percentage of it to the government. So we would give a percentage of that wealth tax to universal health care to help pay for it in this country.
Yeah, I understand what you're saying. But like I was saying, we have needs, we have government, we have military, we have all of that, and it's a lot to handle. And neither of us see the severity of it. And like you're saying, the rich and poor taxes situation. I feel no matter what we do, poors will still poor and people in poverty will still be spending more money than the rich because people in poverty cannot afford to go grocery shopping and have cooked meals at home. We like they have to go to like fast food restaurants. They have to spend more money to save more money. If you understand what I'm saying. And plus if we spent all the money on healthcare, then we still have to give all the money back at the beginning of the year to every citizen that has spent taxes and is, has a job and all the standards that you need to get your tax refund back.
So you're saying that the money that we're putting towards universal health care is you we can't afford it?
Not necessarily. I mean, all right. So if you spend all your taxes and you are a working citizen and you file your taxes and you get your tax return, we have to afford that every year for every single citizen that fills out their tax return. And that is millions, possibly billions of people.
But the thing is, right now we can afford it, which is why we're doing it. So, if we tax more from the rich and then use that for universal health care, we will just be giving out the same number of tax returns because, they get the same number of tax returns as they do normally. They just pay extra now. So now we just have extra money to spend on whatever we need. You get what I'm saying?
Yes, if we have extra money, spend it on healthcare. I do
Yeah,
agree with that.
which is where the rich tax comes in, which is where we would get that money for. So, not necessarily all of the extra money we get needs to go toward that, but important systems and stuff uh, need to be funded, like universal health care. So, um, let's move into what we think should be included.
Hold
Oh, go ahead.
before we continue, I believe that we should do what Canada does. Canada has a national health insurance system. The government pays for services provided by a private delivery system. Private supplemental insurance pays for vision, dental care, prescription drugs. Hospitals are publicly funded. They provide free care to all residents, regardless of their ability to pay. The government keeps the hospitals on a fixed budget to control costs, but reimburses doctors at a fee for service rate.
Yeah, that sounds pretty good. They're just getting the free care that they need, and I definitely think America can afford that, and definitely should invest
Oh,
in that.
America can afford it, and I do agree with what you're saying, but I feel like there will be plenty of complications if you are understanding what I'm saying.
Yeah, I mean, any country who tries to implement a brand new progressive system is going to have some complications. But I think, like Canada, we can work it out. America is very similar to Canada in many ways, so if if they did it, I feel eventually we can do it, similar to them or even better.
Yeah, yeah. I think we are coming to an understanding. But continue of what you were saying before I spoke on Canada's.
Yeah, so let's talk about what we think should be included with free healthcare. And Bradley, I'll let you start off with that.
I feel once again similar to Canada. It should be dental care, vision. It should be prescription drugs. It should be doctor visits, and like dental is a big one because I know braces have put people in debt. I know um, eye doctor visits and glasses and contacts that can also put people in a jiff. You know what I mean? So I do understand that being free, but I don't believe that surgical should necessarily be free, but it should be a lot cheaper than what it is today. because I've heard of people going homeless after surgical operations and everything, not being able to afford it.
Yeah. Uh, I kind of disagree there. I think that if it's a if it's a surgery that's necessary that you need to have, or else there's a potential, there's like a life threatening situation in there, I feel like that should be covered. But if it's something that's not necessarily, you don't necessarily need, then I think it should cost money. But if there's something that could potentially cost a human life, then that should be free. You know what I'm saying? Like if you had to remove a tumor or get cancer treatment, that should be free.
Definitely. But what I'm saying is, um, not necessarily that we have to pay the big bucks for a life or death situation. They should do the operation regardless. That is an actual oath that is already in America. You must treat the patient no matter skin color, no matter background, no matter paycheck, no matter anything.
Hmm.
You have to treat the patient. That is a doctor's oath. And um, I feel you should, if they should do a background check, check your financial income, and then however much you can pay, you should pay, and however much you can't pay, they should find the difference and
Well, but isn't
pay
that
it forward.
isn't that kind of, I don't know, necessarily unfair, but like it's kind of like the salary situation. So like if you make under a certain amount, you wouldn't have to pay anything. But like, if you're rich, you would have to pay a little extra. But I feel like it doesn't matter how rich you are. Your life is equal to another. You shouldn't have to pay more to save your life than someone who has less money, because it's still a life. Now, other situations, I can see that where you would have to pay more because you earn more. But when it comes to life or death, I don't think it really matters what your income is.
No,
I think your
what I'm
human
saying,
life comes first.
yes, yeah, of course. They do the operation no matter what it is. They take care of the patient, make sure the patient is in stable condition. But afterwards, you know what I mean? Like I don't feel I do understand what you're saying unfair, but I also believe what you were saying yesterday is a little unfair. Not much. I feel like it would help a lot. But just because you make a higher income, you should pay more taxes, which we'll speak on more in another episode. But it's all about opinion. You know what I mean?
Yeah, I guess. I completely agree that uh, they have to take the patient no matter what, and they can't treat a rich patient before a poor patient. It just whoever gets there first, because a life is a life. Um, but like I said, what I disagree on is that you would have to pay separate amounts for, life-threatening surgery because you make different income. I think your life is just as valuable as another, and so you shouldn't have to pay more because you make more. But in other situations like taxes, you should have to pay more because you make more. But that's completely different. This is a human life that matters.
Yes, and if a in a tax thing, it is also human lives because I know people that have lived off of taxes and lived off of government checks and all of that, which, like I said, we will speak on in another episode.
Yeah.
But um, it really depends on the surgery. Like if it's like you said, cancer, tumor, yes, that should go without saying. Take care of it, like no doubt in my mind. But like you said, taxes go to universal health care and everything like that. It's it's affordable and it's doable, but is it reasonable?
What do you mean reasonable? Like spending a lot of tax money on universal health care?
It's reasonable to put in money on universal health care, of course. It is, but is it our main focus in America today? It's human life. It is life or death situations. a lot of the time, but it could be anything. And you're saying life or death surgeries, of course, do those. Don't worry about pay, do them. But what if it's not life or death? What if it's you getting paralyzed, you becoming a, this is an offensive term, a vegetable, where you cannot move, where you cannot do anything, and you're alive, but you're suffering.
Well, I mean, in that case, you should still be treated. It doesn't matter what you are. In any case, should be treated. That's the point of universal health care.
That's what I'm saying. But your main focus that you're only talking about is life or death.
Well, that was just one of my points. I was going to move on a little bit after that, but I was just explaining that, life or death should obviously be free, but other things should be free, which leads me into the next thing that I wanted to talk about. What else should be free? Ambulances, like we talked earlier. And I said treatment for any kind of disease you have. Physical therapy, which is also very important. There's a lot of other things. I'll focus on ambulances for now. A lot of people, like I stated earlier, will choose not to get an ambulance because they can't afford it, which in some cases isn't the right decision because you would need an ambulance, but it has to be the right decision because you can't afford it. And it can put them in debt. It could prevent them from getting other necessary things. If they spend money on an ambulance, they might not be able to afford groceries for a couple of weeks, which it sounds ridiculous, but it's true. So I definitely think that should be free. Physical therapy kind of falls into the doctor. A lot of people after surgery or treatment, they have to get, they have to have physical therapy. Older people, even people in my family, rehabilitation. Even people in my family have had to go through that, and it's cost a lot of money, and it's taken, a big effect on us. So that should be free. Bradley, what's your take on that?
I agree with that. I'm starting to understand what you are saying more and more because as I'm looking at statistics, I see that compared to Australia, Canada, France, Germany, Singapore, Switzerland, and the United Kingdom, United States pays a tremendous amount more than all those other countries in when it comes to healthcare.
Mm-hmm.
They put in more money. They take care of it more. So I feel what you were saying, and this is a chart from 2018. So more than likely have declined since then. But from what this says, other countries have this problem worse than we do by a tremendous amount. So let's focus on pros. So what are some pros of some universal healthcare and non-universal healthcare? Pros. Let's focus on cons, and after we discuss the pros.
Well, I think the obvious pros are people who can't afford it, their lives could be saved, or their family lives can be saved. It can help their family out a lot. People in extreme poverty can afford to get treatment, even for small things. Like if you're in poverty, you might not be able to afford painkillers or headache medication, but it's just quality of life things like that, or saving of live things at the extreme level. So that's an obvious pro is that it's free and it could help save lives.
Also, there are many people in America who would abuse free prescription drugs as painkillers. Painkillers are very addictive and is a lead cause of death in America.
That's a good
It is
point.
a very
And I
large,
have and I have a
large problem
I have a
that a lot of government officials need to focus on drug use and drug abuse in America instead of focusing on the big things, as in meth, heroin, cocaine, everything, like all the big stuff. There's little things that they are giving to our citizens that are killing them.
yeah.
Painkillers
That's that's where I'm
and Xanaxes and pills and all types of stuff that is putting people in situations where they need and want more.
Yeah, I understand what you're saying. So here's my solution. This it sounds strange, but I think there should be a limit that they can give you, not based on a person, but based on your situation. So, like, if your situation is serious, just like a doctor, they would give you the right amount because it's not up to the president of the United States to tell you how much stuff you would get. It's just like it is your doctor now, but it's free. So your doctor would tell you, okay, we need to take this many pills a day. Um, it would just be like normal but free. Uh, and it could technically still be abused, just like it is now. But there's other solutions for that, and I don't think universal health care has a direct effect on that because yeah, the pills will be free, but they're not just gonna give that away. You know what I'm saying? Doctors aren't just gonna be like,
Um,
yeah, you can take painkillers. Whatever. That there has to be a certain
I'll,
situation.
I will explain to you what I mean more, and this might change your mind. Growing up in a situation, seeing people abuse medical and all types of prescription drugs, all it takes is doctors are nonchalant. Some, not all doctors. You go into a doctor's office, you say, "Oh, I'm in so much pain, painkillers." It's that simple.
Yeah,
So
but
all it
but
takes is a little white lie.
yeah, I get
You
what you're
are
saying, but
abusing drugs.
but think about this: if there are people who are doing that, and then they say, okay, well, there's people who are abusing it, so let's stop. What about the people who really do need those? What happens to them? How do they
They
get
should do
theirs?
medical tests instead of just saying okay
Exactly, that's what I'm saying.
nonchalantly and just
There has to
go
be
on.
some sort of
Like
confirmation that
they
they
should
need
take
it.
more precautions.
Yeah, there has to be some sort
More
of
precautions are definitely needed before
yeah,
we move on to universal health care.
some sort of cause that you need it for. They shouldn't just give it out. You have to a little bit better regulation, which I'm not sure how to do that, but
And
universal
another
healthcare
thing,
just does it for free.
um, this may sound rude, but it says here on this chart some pros and cons of universal healthcare. There are cons here, and it says forces healthy people to pay for others' medical care. Healthy people does not always mean that you're in a healthy situation.
Yeah, that is true. And what it means, I assume by that is taxes, like
Yes.
increased taxes to pay for healthcare. Well, here's the thing: there are so many U.S. citizens, and universal healthcare. Yes, it would be quite expensive, but what's more important? Human lives or a couple extra, a little bit extra on your taxes. So let's say, with if we increase that, the rich people tax, and we increase our taxes just a little bit, we don't necessarily have to do this for the extreme poverty, proportional, like we were talking earlier, then it wouldn't be that big of a detriment, I don't think, to younger people who are healthy. Um, and I also feel like I wouldn't I wouldn't care at all to pay for someone's health care because or not necessarily like the whole thing, but to give towards it because you're thinking about how you're helping someone out a lot. You're helping their health. Um, you're helping them stay alive in many cases. So by saying that it's forcing young people to pay for other people's taxes or other people's stuff, it's not actually that serious.
It did not state young, it said healthy.
Well, yeah, young and healthy people, whatever. Any healthy person, it doesn't matter. And sorry for that beeping.
Here, I have a live chart of registered deaths in America today so far. 3,236. It is 10 a.m. in the morning. Think about that in 24 hours. And think about the amount of money that is going from taxes to universal health care.
Can you say it again?
3,238 deaths. And it's going up as we speak. Like right now, it's 3,239 deaths.
Just from today?
And that is registered. There are deaths that are not registered per day. There are many people in their homes right now that are not alive as we speak. There are people dying as we speak.
Yeah. Some of that is a direct
So
result of
universal
not
healthcare
being
could
able
help
to.
with that, but
Yeah, some of those deaths are a direct result to not having affordable or ample resources to support your health.
in our state, Kentucky, there are 46,074 deaths per year, 126 per day.
So this is a wake
That
up
is just
call.
in our state.
This is a wake up call, people. Universal health care is our is our country's next progressive step into making the world a better place. We have to do this in whatever way we can. Um, it's important for our people's lives. Uh, you know, you may say that it's the government infringing on what you can and can't get, but it's not going to be like that. There's going to be policies. There's going to be so much more to it, more than we can even comprehend right now. People are going to be helped so much by this, and it's just an important thing that we have to do. And I think on that note, that's a good end
Hold
to
on,
today's
Carter.
episode.
Slow down, slow down. Before we end this episode, you are taking what I'm saying and throwing it out the window. I'm not saying that we need to do universal healthcare right now. It would help, trust me. But one doctor a day sees about average 51 patients a day. You know how many doctors there are in America?
Quite a few.
That is everyone paying for a doctor visit with their taxes.
I know, but it's not necessarily. I have to look into it, but there's a lot of people in the United States.
Perhaps next episode can be a part 2 to this whole situation, and we can do more research.
Yeah, I think eventually we could do that.
There are, all right, like I said, there are averaging somewhat 40 to 60 patients today per doctor/physician. And there are over 985,000 people studying to be physicians in college. I cannot find an accurate number for how many physicians are actually in the medical business as we speak. So that is a lot of money. But we, like I said, perhaps part 2, we might even have 2 episodes go up today. So y'all be looking out for that. Thank you for coming and watching the stream.
Well, before we end, I do want to say this one thing. Like you were saying, there's a lot of doctors, there's a lot of people training to be doctors, so and so and so and so. But like our future episode, we're going to talk about taxes, proportionate taxes. People in poverty who need it most aren't going to have to pay that much. Rich people who may not need it as much are probably still going to have to pay more based on how they are. And people in the middle are just going to have to pay a little bit extra. But what's the cost here? Okay? Would you rather have to potentially be forced to not get an ambulance, not pick up medicine, or not go to the doctor because you can't afford it, or pay a little extra on your taxes every year to get a doctor's appointment? Thank you for checking in. We'll see you guys next time.
Like I said, before we end, we'll make another episode today, possibly. Depends on my partner's day and depends on if we're busy. So thank you for tuning into the podcast, and we'll see you later.
Sorry. All right, we'll see you guys next time.